This video is about the ankle joint. Ankle joint is also known as the talocrural joint. Talo means the talus bone and crural means the bones of the leg. It is a synovial joint, consists of joint capsule and lined by the synovial membrane. It is a modified hinge type joint. Now the ankle joint occur between the distal end of tibia, fibula and the talus. We'll first discuss what are the articular surfaces. Now the weight bearing surfaces of the knee joint are the upper surface of the talus or the upper trochlear facet of talus. It is a saddle shaped surface, and the inferior facet of the tibia or the inferior surface of the tibia. Articular surfaces of tibia and fibula form a bracket shaped socket. This is lined with the hyaline cartilage, and this socket you can see in this lower picture. The socket is known as the mortise. Now the mortise which is into the trochlea of the talus fits into. This is why sometimes this joint referred to as a mortise joint. You can see in this picture the nice pocket formed and the talus fits into this socket. You can see the joint space as well. So how is the articular surface of the talus? It is known as the trochlear facet of the talus. You can see in this picture, it is saddle-shaped superior articular surface. This facet articulate with the tibia and fibula. Now you can see in this X-ray, medial and lateral malleoli grip the sides of the talus and they do stabilize the trochlea. What are the articular surfaces of tibia and fibula? This is the coronal section weaving posteriorly. This is the ankle joint. Now you can see in this picture, medial surface of lateral malleolus articulate with the lateral surface of the talus, and tibia articulate with the talus in two places. One is tibial inferior surface form the roof of the mortise and transferring the body weight to the talus. And then the medial malleolus articulate with the medial surface of the talus. So how the ankle joint capsule attached to the margins? Joint capsule attached to articular margins of all three bones. Anteriorly, joint capsule attached to talus neck, leaving some distance between the articular margin. And posteriorly, the capsule attached up to the posterior tibiofibular ligament. Synovial membrane attached to all articular margins and line the capsule internally. Ankle joint is supported by ligaments, and these ligaments reinforce the joint. There are two main ligaments we need to discuss. One is located laterally, that is the lateral ligament. One is located medially, that is the medial ligament or the deltoid ligament. Now you can see it is not a single ligament. This is the lateral ligament. It consists of several bands. Medially also it consists of several bands. So we'll talk about the lateral ligament of the ankle. It is a compound structure, consists of three completely separate ligaments. You can see there are three bands. These three bands radiating from lateral malleolus and collectively called the lateral ligament. Anterior and posterior band pass to talus and the intermediate band pass to calcaneus. So namely, anteriorly positioned anterior talofibular ligament between the talus and the fibular bone, and the posterior placed posterior talofibular ligament, and then in the middle it's calcaneofibular ligament. So the anterior talofibular ligament extend from the lateral malleolus to the neck of the talus, and posterior talofibular ligament extend from malleolar fossa to the lateral tubercle of the talus, and the calcaneofibular ligament extends from the tip of the lateral malleolus to the lateral surface of the calcaneus. So these three bands consist of the lateral ligament of the ankle. Then we'll discuss what is the medial ligament or the deltoid ligament. It consists of several parts as well, but they are arranged in two layers, superficial layer and the deep layer. These bands fans out from the medial malleolus to the adjacent bones, talus, calcaneus and navicular via four different parts. We can identify them as tibionavicular between the tibia and the navicular bone. This is the tibionavicular part, and the tibiocalcaneus from the medial malleolus to the calcaneus, and the anterior and posterior tibiotalar ligament from the tibia to the talus. And also you can see in the medial aspects more toward the plantar side, the spring ligament or the plantar calcaneonavicular ligament. Sometimes it's also considered as a part of the deltoid or medial ligament. So what are the bands belong to the superficial layer? Now the superficial layer has variable attachments and it crosses two joints. We'll see what are they. First one is tibio-navicular. It's between the tibia and the navicular bone. And you can see it crosses the joint between the talus and tibia and the talus and the navicular. And the next part is tibiocalcaneal. This also crosses the joint between the tibia and the talus and the calcaneal. So these are the two bands belong to the superficial layer. Then into the deep layer, it consists of anterior and posterior tibiotalar parts. Obviously, this crosses one joint. It is between the tibia and the talus. We'll discuss the stability of the ankle joint. Now you can see medial malleoli and lateral malleoli grip the sides of the talus and stabilize the trochlea. During the ankle joint movements, malleoli grip the talus tightly, so stabilizing. Now this malleoli grip on the trochlea is strongest during dorsiflexion because this movement forces the trochlea between malleoli. But in contrast, when it comes to plantar flexion, ankle joint relatively unstable because trochlea lies relatively unstable position or fits loosely within the mortise. That is why when it comes to ankle joint injuries, the injuries most commonly happen during the plantar flexion of the joint. For all practical purposes, ankle joint may be regarded as a true hinge joint. It means the movements occur uniaxially around a single plane. You may heard about the inversion and eversion of the foot. This is not occur at the ankle joint, but it occur at the subtalar and mid-tarsal joints. These joints belong to the joints of the foot. I will discuss these foot joints in another video. So the plantar flexion and dorsiflexion are the only significant movements occur at ankle joint. And the rotation axis, this is the axis. It is not horizontal, but instead it slopes downwards and laterally. Now the plantar flexion can occur up to 20 degrees. Plantar flexion is moving the sole towards the ground. It is obviously produced by the muscles and tendons of the posterior aspect of the leg. Those are gastrocnemius, soleus, and flexor hallucis longus, flexor digitorum longus, tibialis posterior, plantaris, and also by the muscles of the fibular compartment. Those are peroneus longus and brevis. And the dorsiflexion is moving the foot towards your leg upward. It can occur at 10 degrees. This is facilitated by the muscles of the anterior compartment of the leg. Those are tibialis anterior, extensor hallucis longus, extensor digitorum longus, and peroneus tertius. Blood supply to the ankle joint is derived from the fibular artery, anterior and posterior tibial arteries. You can see here, this is the anterior tibial artery, which is a branch of the popliteal artery. Come into the anterior compartment above the interosseous membrane and descend down. And it gives malleolar arteries, lateral and medial. And here you can see the posterior tibial artery and the fibular artery. Those also give branches around the ankle joint. Nerve supply is from the deep peroneal nerve and the tibial nerve. So deep fibular nerve is a branch of common fibular nerve, and around the ankle joint it gives innervation to the ankle joint. And also by tibial nerve it gives branches at the ankle joint. So what is the most common way of these ankle joint injuries happens? Ankle joint is also a most frequently injured major joint in the body. Ankle sprains or the torn of ligaments is the commonest. As I say, in plantar flexion, the joint is not in a very stable position. Ankle sprains almost always occur in inverted and plantar flexed foot when the foot is in weight bearing position or touches the ground. When a person steps on an uneven surface and foot is forcibly inverted, the lateral ligament is going to injure because it is much weaker than the medial ligament, and also this ligament is the one is going to resist the inversion. Now in the lateral ligament also, the anterior talofibular ligament part is the one is most vulnerable to injure and most commonly torn during the ankle sprain. So in this video we discussed about the ankle joint, what are the bones composed of the joint, how the movements occur, blood supply, innervation, and the most common injuries. Thank you. Stay connected with Anatomy Everywhere YouTube channel.